And welcome back to JKLive right here at Citizen Television. Dr. Githinji is in the house, the group CEO, Amref Health Africa, as is Kwame Owino, CEO, Institute for Economic Affairs. Gentlemen, thank you for your conversation. This is great. In fact, Dr. Gitahi, before the break, you mentioned water in schools and having the necessary. The capital, Nairobi alone, there's a water problem. How will we ever flatten that curve if we can't get the basics straight?
I think allow me first to lecture Manu, because he said I'm lecturing him. So let me just say this, that the role of public, there's something we call preventable death. Preventable death means that those deaths that you can do something about and avoid. The role of public health is to reduce preventable death. So when we say that these are the measures we need to take, so it means that we want to reduce the number of preventable deaths from COVID. That's what we have to do. So to let it, linger on and checked and say we have the resolve is basically being public health reckless, because we'll be saying, it's okay, we'll have the resolve, let a few people die. So I think basically that's the balance we need to maintain to reduce preventable death. And that's what, as public health people, we are supposed to advise on. But of course, there will be some level of mortality here and there. But remember then, back to what you're asking, Jeff, that for containment, hand hygiene is really critical. Hand hygiene is critical, cough hygiene is critical, and this is why there's this balance and debate between wearing masks and cough hygiene. All these things are important. But one of the most effective methods is actually hand washing and social distancing. I was looking at something that was saying there a few C's to look at. First is closed spaces, that the infection is more likely to be in closed spaces is where the infection is likely to rise. So that's why even when you look at the history of the epidemic, you find that a majority of the spikes were in dormitories, they were in areas where people are congested, the Korea case of the church. So closed spaces are a big risk. The next thing is crowds, that the more you are, the more likely for the transmission to happen. And obviously, the last one is contact, close contact. So to break the transmission between these three C's, there are several things to do. And those things are very difficult to do in the areas you're talking about. Number one, water, which reduces the effect of contact by breaking the cycle of the virus, by washing it off, is a big problem in those areas. So as we talk about containment, we must also remember that this is part of the plan we are saying, that as you say, we are going to allow the economy to go back fully. Then we must have backstop. We can't just do it because it is time to do it. It's not time to do it. It's not time to do it unless we have the necessary measures. So providing hand washing stations has been an ongoing effort, but I would say that that's not a long-term strategy, that the Ministry of Water needs to work completely with the Ministry of Health to ensure that water is a constant feature in some of these areas. By the way, Jeff, I would like to tell you, beyond just COVID, the water ministry probably contributes as much as the health ministry to reducing preventable death of children. Yet, when we look at preventable death of children, we look at the health ministry. But if there was water, less children would die without need to go to the hospital. So it is time that we took advantage of this. Every cloud has a silver lining, and said, can we have water available to every single household through whatever means, whether it's communal, whatever it is. That should be an order, and that should be part of actually preparing whether to reopen or not. The next thing is about this, issues of crowding. If we are talking about reopening schools, and we are reopening schools without having thought through what measures do we make sure that kids, when we go back to school, there is social distancing? So are we going to make sure that only maybe the candidates go back? Are we going to make sure we do differential return, where some classes go on one day, other classes go on another day? Or are we going to even reduce the hours of school? Because, contact time also increases infectivity. Contact time increases transmissibility of the disease. So these things need to be in place. So before we say now we are reopening. So the reopening is not the issue. It's the preparedness. And we must ask the government before these measures are taken that there is a robust plan to ensure that the public is assured and there is trust that the reopening is not allowing people to put themselves and their loved ones in danger.
Okay, Kwame, let me ask you this. If you had a wish list, Kwame, of some quick fixes that can jumpstart this economy, especially in the private sector, what would they be?
Jeff, that's easy. Two things. Our estimation at the Institute of Economic Affairs is that given the shock or the effect of COVID and other shock that the economy has suffered, the country has suffered, there's a loss between 28 billion to the potential 50 billion per month that's being lost on account of the fact that, well, people can go to work on time, but also just because some farms have suffered. So if there's something to do, it actually would have to start from the health side. It's true, as Manu said, people need to go back to work. But it will not be possible, especially, say, within a factory environment, for people to work close to each other when the possibility of infection still goes up. So I would say this, you're assuming you're talking to somebody from the Treasury. Look, we're going to lose 28 billion at the lower end, 50 billion at the upper end per month for the next 2 years, at least in our estimation at the Institute of Economic Affairs, and it could be more. What that means is I would spend an additional 1 billion shillings every month just for testing. Test as many people as is possible every week. You can ramp it up to about 100,000 people tested every week, not 2,000 per day as we're doing now. What that does, it does two things. Once people are tested and tests available, actually government should subsidize those tests by telling any employer, if you test all your employees, you are amenable to get that money back. Or rather, you qualify to get that money back as a tax break. What it does is this. I work in an office where there are 24 of us. If all of us were asked to come to work tomorrow, I'm sure some of us would be scared of coming to work anyway. By virtue of, look, all of us live in different places, you haven't known who we've been in contact with, and the possibility of spread is high. And some of us have kids as well. So what you do is you say, if you're able to test your employees, we will give you back that money. And what that does is that it becomes an incentive for the employer to actually have those tests conducted. And they know who is safe, and whoever is not safe is then asked to stay at home. What that will do is it will bring up people much, much sooner into work without the hesitation because they know that, okay, my colleagues right now are okay for the time being, and they can test maybe 2 or 3 times every second month. If that happens, then obviously tomorrow everybody is able to actually do. And what government would do is actually just take up that cost. It's losing between 28 and 30 billion, and 50 billion per month. If you spend $1 billion per month for testing for as long as is necessary for people to have the confidence to go back to work, that would be a big boost. So that's the first. The second is this. There are small and micro-sized farms which employ 5 to 6 people. Right now, whether it's in hospitality industry, whether it's in food production, whether it's in other services that they provide. Now, most of these people have to get in income every day in order to pay their employees. So some of them have had slashes in their wages. Some of them have actually been asked to go home for the time being until things get better. One of the things that does is actually breaks the match between employer and employees. And as I told you, some of them will probably risk when this thing reopens to go back. What government could have done is what, as David D suggested a while back, which was cynically ignored but is the correct way to go about it, is just simply put together a lifeline fund. As I told you, the loss is between 28 to 50 billion per month. That lifeline fund was very cheap. For 150 loans available to people to actually take up that, distributed through banks to be able to keep their workforce in place. So as soon as all the bad air is cleared, people will be able to go back to work. The problem right now is not only that people are not working, but you've also disrupted supply lines. You've disrupted workers and the match between workers and employees. People have gone on to doing other things. Some of them have gotten unwell and are able to stay at work. It's a very, very dangerous situation. So the first one is make sure you have a lifeline fund for any small and micro enterprise that wishes. I'm not talking about informal sector. I'm talking about formal sector people. They employ a lot of people. Many of them have 5, 6 people. So they're really small. But they really need money to keep their operations going, even if it means to simply keep their employees on half pay so that the match is not. Those, in my view, would be the prerogatives right now. Oh, yes, and the final one is keep schools closed for a while. I know we are all anxious about getting our kids back in school, but guys, if kids come, there are 16 million kids who go between high school all the way to early childhood education. Even if the death rates for kids, which is very low, is 1%, 1% of 16 million kids dying is 160,000. We need to think very, very carefully about this idea that kids are safe. They are only safe if we take all these other measures all together. But when you have that many kids, 1/3 of the country, going to schools every day with the possibility of cross-infections, I think we have to be very, very careful about that. So for the time being, we don't know sufficient. We don't have sufficient information to say that kids can rush back into school. There'll be recovery if within a month or two we see that the curve is not sufficiently flattened or not everything is perfect. Then we can talk about bringing some few kids who need to sit exams or doing whatever it is we need to do. But the losses that will occur, kids will definitely catch up. In my view, there's no reason to hurry with opening schools so far. You can open workplaces and all that because all adults know how to keep themselves safe. So keep kids away from school, ramp up the testing, and have a lifeline. That would be like the best we can do for the economy right now.
Excellent points there, Kwame. Excellent point. Let me stay on you with this next question because you talked about testing. Look at the confusion in the testing protocols at our borders. The Kenya-Ugandan border at Malaba, trucks are piled up 50 kilometers. And of course, truck drivers will come out, they'll mingle with the locals, they'll look for food. That's one border. Look at Namanga now, another mess. How badly will trade in the region be affected?
Obviously, as I mentioned, I think supply lines have been disrupted. So remember, most manufacturers or most people who do imports and cargo, they usually try as much as possible to have their work done, have their work arranged and synchronized in such a way that when the trucks come in, everybody is ready to start the production, and it is possible sometimes for the same trucks or other trucks to actually take back the goods that have been manufactured. So if they're going to be there, yes, you have a 50-kilometer line of people waiting to be tested. We really need to go up there and rush the testing. And this testing is not difficult. All we require is actually to put in more money. And my view is, if you're going to destroy those farms now, even when we get a vaccine, if God smiles upon us and we get that vaccine, most of farms will be in such poor shape that it will probably take them 2 or 3 years to actually get back to where they are. So testing to give people confidence that we are testing massively, we know where the trajectory of this disease is. If it is possible to find pockets of places where the spread is too high and community spread is taking place, there's a surge, you can lock it up again, but you need that epidemiological information to be able to respond. Right now, our tests are too slow. Jeff, in 70 days, going 80 days, we've tested 80,000 people. It's less than 1% of our population. We don't know what we are doing. We don't.
Dr. Gitahi, there's a question for you. We don't know what we're doing.
I think, let me just comment on what Kwame has said. And I have lots of respect for Kwame, as I do for Manu and others and all our citizens. I have a bit of a different view on testing. We expect, and the target for Africa Union and for countries is to at least test 1% of their population to say you've done adequate testing, some level of adequate testing. 1% for Kenya would put us at about 470,000. And now, therefore, we are way behind. We are way, way behind. And the challenges for that, again, they are to do with the government itself, maybe not ramping up tests. We've seen similar governments like Ghana and others reaching 6,000 tests. So, of course, our government has done inadequate testing. That's number one. Secondly, it's because of reagents that have been a problem, but now they're becoming more and more available. So we can ramp up testing, and I would hope that the government and all the other labs that are testing. Now we have also included our lab as Amref Health Africa just a few days ago to start testing as well, because all of us are trying to help the government to ramp up the tests. But you can only do as many tests as there are reagents, as there are health workers to do the test, as there is tracing and sample collection. It is actually a whole chain. So I would agree with Kwame that we have not scratched the surface in terms of the tests we need to do. By now, we should have done at least 1% of the population, which is close to 500,000, and we haven't. We are way off. The areas which I may differ a bit is about the mass testing strategy. Because when you test workers for them to go back home, it doesn't guarantee you that when you test me today and I'm negative, that now my office mates can now relax because I tested negative yesterday because I could come back positive today. So, the only way to assure that strategy is eventually when we actually start to do what we call serology tests or antibody tests, where you're testing whether people have been exposed. Because if I have been exposed, then I have long-term immunity. And therefore you can say I'm unlikely to get infected again, and therefore I can go back to work. But the antigen test, which we are currently doing, which only tests the presence of the virus, cannot guarantee you that actually if you test without the virus today, that tomorrow you don't get the virus. And you know that actually in a few days, if you have the virus, if you test today, and then tomorrow you get exposure because you went home, you went to the club, then tomorrow you get infected, after 2-3 days you start being infectious. And yet we are waiting for a month to test you again. So it's not possible to use testing to allow people to go back to work. What we must do is realize that it's not going to be practically possible for any country to test 100% of the population. So we ask ourselves that since the infection will continue unless we have a vaccine, then the thing is to say that we are going to continue to do containment measures. And those containment measures include all the things we talked about, hand washing, wearing masks and those other things, including testing. But when you talk about testing, I was talking to someone the other day who made a joke and said, there's a reason robbers rob a bank, because that's where the money is likely to be. So the best strategy for testing is actually to test where you're likely to find contacts. Because remember that the thing is to find the people who are likely to be infected so that you do what? So that you isolate them. And when you isolate them, you reduce the other number of people they can actually infect. So the testing strategy that is sound is to test people who are likely to be infected, health workers, people who come into contact with others, people who may be, like border crossing, who may be transferring the infection from one country to the other, rather than doing open mass testing to where you are not sure whether there are cases. But let me introduce another concept here, that it's important to also do surveillance or to see whether you can use other methods to actually monitor whether there are communities that are infected and you don't know yet. Some of those is what I talked about, antibody testing or serological testing. Sorry for the complex language, but it basically says checking whether somebody has been infected in the past, whether they have the virus at that point or not. And that's a blood test. None of these have really been approved by WHO, but in another few weeks, we'll have this approved. And what you do then, you take a sample across the country and you start testing people, testing workers of a company, and you identify how many have been infected in the past. Therefore, you say, for you cannot be infected anymore, so go back to work. So that's what we are waiting for. The other strategy, which we are testing, is testing hand-washing wastewater, where you actually look at all these hand-washing stations across the country, and you sample the water, and you say, is there presence of virus in this water? Then you know, even if the Ministry of Health hasn't announced a positive case in that region, and you find the virus positive in the hand-washing wastewater, then you're able to direct the ministry and say, by the way, we think there is contamination in this region, please go and test. So that would be the only thing I would I would like to respond to Kwame. But in terms of, are we behind in testing? Yes, we are. Grossly behind, and we can do better, and we should do better.
Yeah, absolutely. There's another scientific word that you introduced us to. Some people may have forgotten it, Dr. Ari. Asymptomatic.
Yes, remember is that, and this has caused a lot of problems. Many of us have seen videos, and this is again the failure of all of us to actually have the communities own this response. I saw a video, I think, from Coast Province the other day. We saw one earlier from Nairobi, and these are people who were tested. Remember, in this journey, maybe I need to explain. Number one is that we have certain kinds of people in this chain. First, you have people who are infected, and they are known they are infected. Those people are in two categories. You are positive by lab tests, but you can either be without symptoms, that's what we call asymptomatic, or you have symptoms, that's what we call symptomatic. Now, in the data that we have up to today or yesterday, we know that 85% of people, meaning 85 out of 100 people, have zero symptoms. They are asymptomatic. 85. out of 100. So out of our total 2,000, you can actually calculate how many are asymptomatic. They have no symptoms at all. And then we have the other category of people who are symptomatic, who are only 15 out of 100. Now, those are two categories of the infected people. But then you have another category of people who are suspected cases. Suspected meaning they have been in contact with somebody who is infected, maybe they traveled in, maybe there is an area that is suspected they could have come into contact with somebody. Those also require action, and they are awaiting testing. And those are the people we take to quarantine. So the quarantine is largely for suspected cases that have not been tested. Then when you've been tested and you're positive and you are asymptomatic, you are isolated so that you don't infect other people. But if you are symptomatic, you go for care and treatment, where now you're watched in a hospital because you have symptoms and you could tip over. So we have to recognize those different categories. So the key issue here is to educate people about these things, so that when you pick people because they are suspects, they were in contact or they were in an area that had somebody who was infected. In other countries, they're using tracing apps where you go near somebody who is infected, maybe they have already been marked on their phone and your phone rings and therefore you know you need to take care of yourself. They're using these tracing apps. But in this case, if we don't educate people, we put them in a quarantine center. They stay there for several days waiting for testing, and then they start to revolt and rebel and say, why am I here? What am I doing in here? But they need to be explained to. Why are they in quarantine? Because right now Kenya has not developed guidelines for home-based care of people who are suspected, of people who are infected, but they are asymptomatic. We are developing, the ministry is developing those guidelines, and once they are ready, I'm sure they'll roll them out, where homes can take care of the people who are positive but asymptomatic, or they are under quarantine. For now, it is quarantine at government facilities, which requires extreme care, behavior change, requires people to be explained to, humanity, compassion, and to make those quarantine centers as close to home as possible. As close to home as possible, allowing social interaction through the phone and ensuring that you don't then expose those who are in quarantine to those who are positive. You cannot mix isolated positives with quarantine, because then the quarantine are also being exposed to infection. So the entire area of managing isolated people and quarantine people is a weakness that the government must address, including how to address the psychosocial issues, the anxiety, the fears that come along with it, until we have guidelines for home-based care.
A very delicate balance there, Dr. Very delicate. Kwame, let me ask you this. Let's say some restrictions are eased this weekend, and the curfew maybe not lifted, but maybe pushed to 10, 11 o'clock at night. Would that help?
No, Jeff, I don't think it would help. Let me say this first. I think, yes, our view is that the sooner people can go to work, the better it would be. But my contention remains that if we know that there are asymptomatic people, as Dr. Gitahi has mentioned, most of the activities that happen after 7 o'clock are activities that are related to social places and social interactions. And those are the dangerous places because of the kind of behavior. People speak loudly, they are very in close contact, and some of the clips we've seen circulated on social media suggest that's what's going to happen. So my view is this. I think if a decision is made that people are able to, should be able to go back to work, it will help. Because one of the things that happens is for government to actually use, as I said, there's a 28 billion to 50 billion being lost per month. 7 billion per week, based on the fact that people can't go to work and some people are nervous. It might just help government to actually distribute masks. So instead of police beating up people, they should have some masks, and if they find out that you really genuinely need one, maybe they can distribute that. It helps with that social thing and everything else. What I am nervous about is, I don't know, yes, let me mention this, and it's not to create fear. I don't know that there's any disease in the world that has actually been controlled or eradicated through behavior change. People are who they are. We've been here for 9 weeks, and you can tell many people are now disgusted. Or rather, impatient. Let me say the word impatient. So as soon as it's open, people are going to do back that. So one of the things that I think should be done, yes, I think probably the pressure is too much. People are going to go back to work. But my view is keep kids away from school. I am a worshipper myself. I don't think worship places are safe yet. So maybe unless they have very specific ways in terms of handling numbers, we should hold it for a while, for a while as well. Of course, the water and sanitation obviously needs to continue to be re-emphasized and make that, because the point about this is that this virus is not thinking, but it's lethal. For as long as 80% of us do the right thing, and positive reinforcement is what we should do, we will still stay ahead of it, because what we're actually doing is we're trying to run ahead of it. If we stay ahead of it by 80% of us doing what we do, then that's a fine thing. So basically, some kind of watching will be necessary. I think government's advice and the Ministry of Health is doing its best in this. As Dr. Gitahi said, we still need to do much, much better. I mean, it shouldn't take us too long to actually do the rules for regulation and quarantine. I mean, we can borrow from best principles. I mean, we can also do something because WHO provides guidelines. You can use a rudimentary one and you then reinforce it as you go ahead. But yes, we'd have to open the dials for a while. And if it's necessary, because we know that there are hotspots that were declared by government, so you can say, fine, people can still go to work in the rest of the country, but in those places, Nairobi being one of them, and other parts in the east or rather the coast of Kenya, you actually just need to continue to do that. So it's not the important thing is, what is the logic of our model? And the logic is, as much as is possible, we are still trying to keep as many people as possible away from infections. That's one. Two, try and give hospital workers space and medical workers enough space so that they're not overwhelmed by numbers. And the third one is, my view is this: yes, when I use testing, perhaps I was not being as deliberate as our clinician friend has said. That's true. When I meant testing, it also means there are people who are symptomatic and they do not know it, and they're probably the people who might actually doing the spread. I still insist that if you do it a randomized number, testing about 100,000 Kenyans per week, it's possible, whether you're doing the blood test or whether you're actually doing this other one. It's possible to scale it up enough so that at all times we have a sensible view about how fast the disease is spreading and whether we need to divert resources to some other places to contain it or not, because resources are scarce. I
tell you one thing we've learned kind of by default, Kwame, and this is going to lead to airlines literally folding. You know, you've traveled to New York, to Beijing, to Tokyo, to Johannesburg for conferences. And the last 10 weeks, nobody's done that. We're all Zooming, we're all doing all these kinds of things. That means there's an industry that's going to collapse.
Well, I don't think that it's necessarily going to collapse. I think it'll take a long time. Yes. Well, you have airlines that are, especially domestic airlines in Africa, including Kenya's own, were doing badly to begin with. And if you have an airline that was not doing too well, and then with this big shock, obviously, and people travel less, and one of the things that's going to happen is they're going to maintain physical distancing even within airlines. What that means is airline seats are going to become even more expensive, so fewer people will be traveling. Obviously, that's going to be a big deal for airlines on this continent, especially those that did not have reserves and have not done poorly. That's true. But my view is not thinking about it positively, how governments respond. If the economic stimulus is properly designed, and we think it's getting late by the day, if it's properly designed and executed, other countries have done it well enough, the world economy will recover over time. But it's clear, not as much for Kenya, but many other economies globally are going to contract. Yes, and obviously that affects the industries that are related, such as tourism, international tourism for a while, obviously, and as well airline travel, the aviation industry. Yeah,
absolutely. Dr. G, before I go to tweets, gentlemen, let me ask you one more question. If the economy is opened up, if there is a spike in numbers, who takes responsibility? Will it be the president? Will it be C.S. Mutahi? Will it be Matiang'i? Will it be Dr. Githinji?
It's the president. He is elected by the people. He, at the end of the day, has the ultimate responsibility. Any of us and, all the technical people can only advise, model, and give the information. And then, at the end of the day, the president has to make the decision. So this rests squarely on the president. But that means also that the president must have the best advisors. We must use data. We cannot just have a thumbs-up decision and say, we think it's right to open. And the president must balance, therefore, lives and livelihoods, and at the end of the day, think about what is best for the country. And I think for now, the trade-off between lives and livelihoods can be maintained through science. You can actually reduce the trade-off required by looking at science and looking at, number one, containment measures. Continue to test, continue to trace, continue to isolate, and continue with the measures that we have talked about. On the other side, remember that the real problem with COVID is not infection. The real problem with COVID is severity of the disease in the vulnerable. That's what the real problem is. So if you maintain containment, as I have said, and on the other side, you know exactly how to shield the vulnerable, the above 60, the ones with hypertension and diabetes. In fact, in science terms, you may call it reverse quarantine. Instead of quarantining the positive asymptomatic, quarantine the vulnerable, and whether they are positive or not, and make sure that they are not in contact, in open, crowded contact with people who are likely to be positive. So if you take those two measures, then for the presidency, then you can find a balance between, instead of having to make a trade-off of lock or open, you can find a balance in between containment and shielding the vulnerable. I will say 3 C's. Number one, closed spaces. As you think about reopening, ask yourself, are we increasing people being present in closed spaces? If yes, then don't open. Secondly, crowds in closed spaces. That's the second C. Are we going to see more crowds in closed spaces by making this decision? Then do not take that decision. Third, close contact. Is this decision going to increase close contact? Then don't take the decision. So I would say those 3 C's can actually, with data, with information, can guide a policy decision. Reduce many people in closed spaces, reduce crowds, and reduce close contact. Then within that framework, you can then find where the dial stops, and therefore what you can open and what you can't open, as Kwame was referring to. So it's that balance, but the responsibility is with the head of state.
All right, gentlemen, let's go for a couple of tweets, comments, and questions. Xander Kimani says, it may take us some time to recover our economy, but we will recover. But a life lost can never be recovered. Cases keep rising. Measures are being defied. We are not disciplined enough, and easing movement is a gamble with life. Well, okay, there's Jeremy.
Is that a question, Jeff? Yep, Would you like to comment on that?
I think Jeremy 93 says, it is risky to ease COVID-19 restrictions when the country's COVID-19 cases are shooting up. The only restriction that can be eased or lifted is a curfew. Professor Thomas Mwailago right here tells me there are 2 things that make a person successful: the books you read, the people you meet. He says, kudos to the 2 gentlemen today. It's been $1 million discussion. Well done, gents. And Nemsite says, I'm strongly in doubt. 101% we are not ready to face the next level. Our attitude and many other negative attributes we carry will become counterproductive. We cannot manage this at this pace. We have more than tripled our infections. Whew, a lot of people. Alex Omari says, Dr. Githinji is giving free advice to Kenyans. Life and livelihoods is a big issue. Should you have a stable economy and no healthy people? Or should you have healthy people who are poor? Demographic dividends is at risk. Nashpai says, I hope the government will extend the curfew hours, but cessation should remain. The country is still not safe. More tweets coming in thick and fast. Very healthy discussion today. Pardon the pun. Victor Wamurwa says, we are not yet there with the surging numbers. I think we ought to be careful not to expose a bigger population, which is vulnerable. All right, more tweets. Thick and fast. Amwai Brian says, have we achieved what we wanted when we closed down? Numbers have risen and keep rising daily. How ready are we for bigger numbers? Because easing restrictions with the current trend will lead to higher numbers. And Sefas Kipchumba says, what does night curfew help? And yet during the day, people meet and interact. Wow. Still more tweets. Duncan Onyando. The president should allow the country to resume economically. We have lost a lot, and as per now, we can contain the virus. At least we know how to interact with it. We can actually survive with the virus. It's very optimistic. One more tweet. And this is Jerry Maria 2 says, tough call to balance lives and livelihoods. The life that would be lost to COVID-19 is as important as the life lost to lack of access to medical care, maternal care, or proper nutrition. We need to consider both. Wow, lots of varying reactions. Hey, gentlemen, I'm going to ask for your final thoughts. Kwame Owino, let's start with you. Final thoughts moving forward, sir.
Well, I think just one question by Kipchumba, who says that what does a curfews help with? Look, most Kenyans work in the day, at least those who have a job, and then at night people go to social places. Social places are perfect environments for people to spread the disease, whether from their and so the fact that they've been kept away, of course some people are stealing here and there and trying to have their own parties at home, has actually been extremely helpful. So if he doesn't know that, it's perhaps because we don't understand the circumstances, and notwithstanding Dr. Githinji's explanation, we don't understand the circumstances under which this happened. Finally, I was hesitant to say this, but let me say this. It's not true that there's a trade-off between livelihoods and lives. As an economist, I know that the reason an economy is about people. So it's people who actually participate in an economy. One of the things that we were taking was, look, the question about flattening the curve was about buying ourselves time to use resources more efficiently. So you buy time so that we don't have doctors overwhelmed. You're able to build ICU capacity where it's not necessary, when it's not available, and at the same time you're able to provide other things that are required to help put us in a better place. So there are costs either way. But the decision was very early in the game, nobody knew what was happening. And when it's early in the day, when you don't know what's happening, the decision that was made to keep kids away, to try and have everybody to keep their distance, to learn more about this virus, we are in a far better position 9, 10, 11 weeks later than we were earlier. But this idea that it's either the economy or lives is not true, because even when people go back to work, they'll be going back to work to sustain those same lives. Yeah. Thanks, Jeff.
Well done. Well put, Kwame. Thanks so much. Dr. G, closing thoughts, sir.
Well, what I would like to say is that I'll make one assumption with all the viewers here, that there is no vaccine, that a vaccine doesn't come at all, because we know it's far. So let's all assume a vaccine doesn't come. Then what? It means that the virus will take its natural course and will infect as many people as are susceptible. When the first virus case came here, what we call the index case, it found all 47 million of us susceptible to the virus. And as you go along, that person infected 3, those 3 infected 4, those 4 infected each of them another, and therefore we were seeing this low peak, and now we have seen the acceleration. Without a vaccine, we expect the acceleration to continue, we expect the cases to increase. No measure we will take will stop the virus. This is the fact. We will expect the cases to go on until what we reach a point which we call herd immunity, which is HERD, where so many people have been in contact with the virus that there is not enough people who are still susceptible who are meeting people who are infected, and therefore the virus kind of dies a natural death. That would be the normal scenario if we didn't get a virus, and that's the assumption we are making. In which case, when we are looking at opening versus closing, we must remember that the measures we take are not to stop the virus. The measures we take are to slow the virus, not to stop it. So whatever measure we take, whether you take a hard lockdown, a simple one, or a soft one, you are taking those measures to slow the virus, not to stop it. So assuming there's no vaccine, it means that we are going to live with this virus over time. It will probably, increase, then drop down, and maybe later we may get a peak or not. And this is why in some countries where they did total lockdown, when they opened, there was a surge, because now you had people who were susceptible but had no exposure. The virus finds them susceptible, and therefore transmission continues. The reason I'm explaining is to say that if we are going to live with the virus, the measures that we must take must aim at ensuring we slow the virus. So whatever measures we advise as public health specialists, whatever measures the government advises are to slow the virus. And these measures will include our own activity, hand washing, social distancing, and those measures will also include reducing the C's I said about. I talked about the C of crowded places, close contact, and closed places. So whether we are discussing opening schools, we must ask ourselves, how do we make sure we reduce transmission by ensuring these 3 C's are paid attention to? If we're talking about borders or curfew, we must ask ourselves, the virus will continue, but what measures do we need to slow it down? And that is the balance that we must maintain between whether we will ease some measures or not. And therefore, it all comes down to preparedness, which is a value of government, and also how much can the government provide in terms of social protection. So if you are going to go, the harder the measures, the more you must spend in social protection, giving people cash transfers for food, giving parents, for example, rescue from fees because they were not able to earn and now the kids are going to school, giving rescue plans to informal sector, to formal sector. So this preparedness has to be both on preparedness for the virus, but also preparedness for the economic rescue, social sector, reducing social harm, and also finally ensuring that you can continue providing essential services in the health system, because mothers will still need antenatal care, children will still require vaccination, people with hypertension and diabetes will still require care. So balancing these things is what will result in us living with the virus, because that's what we expect, because there is no vaccine for a long time to come.
No doubt about it. Dr. G, I always learn new things from you. Today's the 3 C's: close spaces, crowds, close contact. Thank you so much for your time, sir. Kwame Owino, I can see the clock behind you. It says it all. Take a look.
Okay.
Take a look behind you.
Thank you.
There you go.
Yes. Yes, I see it.
Gentlemen, thank you so much for your time. Appreciate it. This was a very valuable conversation, and that's what we need to have. Let's keep talking, folks. Keep tweeting at Koinange Jeff, at Citizen TV Kenya. The hashtag is JKLive. I forgot my jacket almost. If it's Wednesday, it's all about those 3 letters on the keyboard, JKL. Thank you so much for joining us. Be home. Be safe, like Doctor says and like Kwame says.